Hi, my name's Sarah Nielsen, and this week is Eating Disorder Awareness Week. So I'm doing some psychoeducation on various feeding and eating disorders that you will find in the DSM-5. These are not to self-diagnose. Please see a professional. This is strictly just for education purposes to maybe learn about yourself, signs and symptoms, maybe learn for somebody else. I post this in my intuitive eating free education group on Facebook, on my Counseling with Sarah Nielsen page on Facebook, on my Instagram, which is July Moon, and here on this YouTube channel. So let's get into it. So today I'm hoping to cover Pica, rumination disorder, and maybe Arfid too. That's the goal, is all three. That way we can use the other days of the week to discuss the other ones. So we'll see how far we get. So let's start with Pica, and pardon me because I'm going to put my reading glasses on to see. So Pica is it falls under feeding and eating disorders in the DSM-5, and it is defined, there's a word for you, defined by eating non-foods, basically non-substantive, non-nutritive foods. I gave some examples in a video yesterday. These are just random examples. It could be dirt, it could be chalk, it could be anything that's not food. Sometimes it's dangerous things. I've seen that happen before, actually. So this is a eating of non-food substances. We are not talking about a singular incident. We are not talking about toddlers who typically in babies have a propensity to pick things up and put it in their mouths. Okay, we're not talking about run-of-the-mill kind of standard situations. This is going on for, and I'm not going to get into super detailed criteria because I don't think that's helpful or necessary. I'd want to give you an overview, but we're talking about a length of time. Okay. It is inappropriate to the developmental level of the individual. So like I said, it's common with babies and toddlers, versus say a teenager, for example. All right, this one we're not going to spend a whole lot of time on, but a couple of other things just to share about Pica is the prevalence is unclear. It is common with intellectual disabilities or developmental disabilities. It can occur in normal developing children, pardon that word. And it can occur with females during pregnancy. That's an interesting one, and I've read that before because there may be some sort of nutritive deficiency going on. Okay, so we're going to leave Pica at that one, all right? So it is consuming of things that are not basically to be eaten for a length of time that are not developmentally appropriate and not always, but often coincides with intellectual or developmental disabilities. All right, rumination disorder. So this one can be a little bit harder to hear about because sometimes people have an aversion to the talk of rumination, regurgitation, vomiting. So if that's not your thing, you may want to fast forward. Rumination disorder is repeated regurgitation of food. Again, it's over an extended amount of time. It is not due to some sort of other medical condition. So what may happen is partially digesting food and then bringing it back up to regurgitate it, to rechew it, to reswallow it, and typically without any apparent like nausea, involuntary retching, or disgust. I know. This one's a little bit, like I said, a little bit harder to talk about. This is also why there's so much shame and guilt with eating disorders, because somebody who is engaging in this or any of them it doesn't mean you are, let me be very clear about that, but may feel gross or weird or like they're the only one. Clearly you're not if you're dealing with this because it's literally in our book, okay? So you're not alone. Rumination disorder often also co-occurs with intellectual or developmental disabilities. That doesn't mean that's the only populations that it happens with, okay? And then let's get to Arfid. So Arfid is avoidant restrictive food intake disorder, okay? And this is where I'm going to read a little bit here for you. It's an eating or feeding disturbance. And examples: apparent lack of interest in eating or food, avoidance based on sensory characteristics of food, concern about aversive consequences of eating, like it may not feel safe, quote unquote. And you may, as a side effect, a byproduct, you may experience significant weight loss. You may have significant nutritional deficiency. You may depend on nutritional supplements or some sort of a feeding tube, J-tube, G-tube, and it is going to have a large interference with your social functioning. And there's some other criteria, but that's what I want to focus on. That's the kind of the foundation of Arfid. So avoidant, restrictive for those different reasons. They don't feel safe. It could be a texture sensory issue. And with Arfid, they are having adverse effects on their nutrition, being deficient, weight issues, and interference with psychosocial functioning. So, their ability to function on a social level. There's some other kind of interesting facts about it. It does manifest more commonly with children than adults. That doesn't mean adults can't have Arfid. They certainly do. Kids, listen, I don't want to dismiss it as a stage, but sometimes kids do go through an Arfid-like kind of phase where they get very averse to foods. They may not experience the other parts, thankfully, like the low weights or nutritional deficiencies. But, you can put anything on a continuum as far as like level of degrees that it's happening. And so sometimes kids kind of go through this as a phase. Some other interesting things is it often coexists with anxiety disorders, autism spectrum disorder, obsessive compulsive disorders, ADHD. ADHD is a neurocognitive, and so it can, neurodevelopmental, and so it can fall with that. There can be environmental factors like family anxiety, family feeding disturbances, and it can also coincide with history of gastrointestinal conditions, esophageal conditions, acid reflux, vomiting, other kind of medical issues that then cause this avoidance and restrictions. So that makes sense. It's also found to be equally common among men and women, so that's kind of interesting. So I know this went longer than I wanted. That's the basis of those. Tomorrow, we're going to discuss anorexia nervosa, and so if you want to learn about that, come back tomorrow, follow, comment, like, share, ask any questions. I would love to hear from you. Thank you so much.